So hello students, let us discuss MCQ of the second test, dental materials. The first question is the nature of adhesion and union between the glass ionomer cement and the tooth structure they are. Well, we all know that GIC, it is a acid based material. So it achieves retention by both the chemical method and micromechanical method. So GIC, it will receive retention by both the method. One is chemical and other is micromechanical interlocking. So the glass ionomer cement, it achieves adhesion to the tooth surface through combination of chemical bonding and adhesion. So when GIC it is applied to tooth surface, it can chemically bond with the hydroxyapatite in the tooth structure. So this chemical union provides a strong and durable attachment. The macromechanical union involves the physical interaction between the two materials, like the mechanical undercuts or macro retention. The micromechanical union involves very small scales interaction like micropores and irregularities in the tooth surface that provide retention through interlocking. So answer is B. Material of choice for non-acid cervical abrasion is the resin modified GIC. We know glass ionomer, it is a restorative material that is used in dentistry. The material but it may not be the material of choice for non-acid cervical abrasion. The resin modified GIC, it is a material of choice for non-acid cervical abrasions. So resin modified GIC will combine the advantages of both glass ionomer cement and resin based composite material. So it will offer a good adhesion, fluoride release and aesthetic compared to the traditional GIC, so making it suitable for restoring the cervical abrasions. The cement that have a longest working time, well, it's the zinc oxide eugenol cement. The zinc phosphate cement typically has a short working time. It sets relatively quickly once mixed, while the zinc oxide eugenol cement, it has the longest working time. The zinc oxide eugenol cement, they are known for their extended working time that make them suitable for situation where a slow and careful placement is required. In casting, the metal substrate for metal ceramic restoration, it is necessary to use the phosphate bonded investment. They are used with high fusion metal ceramic alloys. So your answer would be phosphate bonded investment. So in the casting of metal substrate for a metal ceramic restoration, it is necessary to use a phosphate bonded investment. So they provide the necessary, so they can withstand the high temperature required to melt and cast the metal surface. The most superior of all retro filling materials, MTA, has all of the following advantages except The answer is easy to manipulate and short setting time. We know MTA, it is difficult to manipulate and it has a long setting time. So despite these disadvantages, it is the material of choice today. Retro filling, also known as reverse filling, is placed to seal the apical portion of the root canal. So this procedure is used when apicectomy along will not yield good results. So in order to provide apical seal, we place a reverse filling material. So MTA is favored for its advantages like it is the radio-opaque, it is hydrophilic, biocompatible, non-toxic, and it is ability to induce the hard tissue formation. So during the manipulation of GIC, the preferred one is we prefer the cool glass slab. So during manipulation of zinc phosphate cement, a cool mixing slab should be used. So a cool slab, it will prolong the working time. And setting time and permits the operator to incorporate a maximum amount of powder before the matrix formation. So a cool glass slab helps to prolong the working and setting time of the cement. The fins or cracks may be produced on casting because of fins and cracks represents the casting defect caused by rapid heating of the investment material. So fins or spines in the cast can be produced due to combination of factors including cracks in the investment material, too rapid heating of the mold, and steam production, which can cause the walls of mold, that is the investment, to flake off. So all these factors can contribute to formation of undesirable fins or spines on the casting. Which of following is not a part of direct gold restoration? The dipping each piece of gold in alcohol to improve cohesion, it is not typically a part of direct gold restoration procedure, whereas the condensing each piece of foil with the 10 to 15 pounds of force is the required force that you need. This step is very crucial to ensure there is proper adaptation and condensation of gold foil to the cavity walls. Third, we can use is increment method of placing gold in the cavity. So that will allow a better adaptation and reduce the risk of voids. Isolating the tooth with the rubber dam, it is a standard practice in restorative dentistry to keep the tooth dry and free from contamination during the procedure. The property of gold that is not affected by cold working. The answer would be modulus of elasticity. It is also known as Young's modulus. It is the measure of material stiffness when or ability to deform elastically when material is subjected to force. So it is not significantly affected by cold working or mechanical deformation. In contrast, properties like hardness, ductility, and proportional limit can be influenced by cold working process. So that can alter the material microstructure and mechanical properties. To prolong the working and setting time of zinc phosphate, cool glass slab is used. We have already discussed this one before too. Among the following cement which have highest compressive strength. Amongst the option listed, the auto-polymerizing composite luting cement has the highest compressive strength. So that can provide a stronger bond. The specific value is 314 MPa. The zinc oxide eugenol cement exhibit a faster setting rate when mixed on chilled glass slab that has condensed water on its surface. So this question already discussed. So zinc oxide cement, it exhibit a faster setting rate when mixed on chilled glass slab that has a condensed water on its surface. So as we know that water, it is essential to initiate the reaction. So the setting mechanism of zinc oxide eugenol involves the hydrolysis of zinc oxide. And the reaction between zinc oxide and eugenol to form a chelate. So water, it is required to initiate this reaction. The reaction, it proceeds more rapidly in a humid environment. So water in the environment, it can accelerate the setting reaction of zinc oxide eugenol cement, making it set more quickly. On a casting, a localized shrinkage porosity is avoided by. So during casting, localized shrinkage, it can be avoided by number one, flaring the point of sprue attachment, placing a sprue in such a way that hot spot formation is avoided, not using excess long sprue. So the answer is placing a sprue in such a way that the hot spot is avoided. We have discussed in details about localized shrinkage porosity in the casting chapter. So go through it very well. Which of following would not be used for smooth surface carving in amalgam procedure? Well, it's the cleoid discoid carver. It is used for carving on the occlusal surface, and it is not designed for use on the smooth surface such as buccal, lingual, mesial and distal surface. So your answer would be C. The cement that has antibacterial property, it's the copper oxide cement. So it can exhibit antibacterial properties due to release of copper ions. The accelerated tube of zinc oxide eugenol paste contains, well, the answer is A. The microcaques, which form at elevated temperature in thin east areas of alloys which are unable to resist the stresses caused by investment material during solidification. So the microcaques that form at elevated temperature in thin cast areas of alloy, they are known as hot tears. Bioactive cement has active ingredient. It has calcium silicate as active ingredient. So bioactive cements such as MTA, they are primarily based on calcium silicate. Following are the name of waxes that can be used in fluid wax technique for posterior palatal seal placement, except well, the microcrystalline wax, it is not typically used in the fluid wax technique of posterior palatal seal placement. Instead, waxes that flow at mouth temperature like correcta wax, Iowa wax, HL physiological paste, they are used for this technique. So these waxes will allow for proper adaptation and sealing of the posterior palatal seal in the dental prosthesis. The dental cement that releases fluoride is zinc silicophosphate. In composite, journal increment recommended for complete curing. The answer is 1 to 2 mm. So it is recommended to cure composite in 1 to 2 increments that allow for effective light penetration and curing through the material, ensuring a proper polymerization and the bone strength. The epsilon in high copper, the answer is C. So remember the gamma, beta, gamma 1, gamma 2, eta, remember these. The setting reaction of zinc oxide eugenol. Well, the setting reaction of zinc oxide eugenol cement involves the hydrolysis of zinc oxide followed by chelation between zinc ions and eugenol. So the answer is hydrolysis and subsequent chelation. So the resulting zinc ion react with eugenol to form a chelate. The gas entrapped within the mold leads to which type of porosity? So the gas entrapped within the mold can lead to back pressure porosity in casting. So this type of porosity occurs when the gas it is entrapped in molten metal as it is poured into mold that can cause voids or porosity in the final casting. So this has been already discussed in casting chapter. Go through that the chapter video. The Brinell hardness number in gold it is directly proportional to the tensile strength. Epsilon in high copper is already discussed. The nodules on the intaglio surface of casting they can be prevented by. To prevent the nodule on the inner surface of casting, it is advisable to spray a surfactant on the wax pattern before investing. So this surfactant would help in wetting and spreading the investment material evenly. So that can reduce the formation of nodules or other any irregularities on the casting surface during the investment procedure. The powder liquid ratio used for mixing when used as a luting is 1.5:1. Which burrs they are used in trimming of microfilled composite? We use diamond burrs. So we use them because they minimize the risk of chipping or damaging the composite material during the trimming procedure. So diamond burrs they are known for their cutting efficiency and their ability to produce a smooth and finely detailed surfaces on the dental restoration. Which of following should not be used to finish amalgam? Well, a rubber disc should not be used to polish or finish amalgam restoration. So final finishing should be done with the appropriate finishing burrs, white burrs, wet abrasive powders in paste form. So using a rubber disc, they can raise the temperature. above 60 degrees Celsius. That can cause irreversible pulp damage and they should be avoided. Moving to the next question, the free eugenol in the root canal sealer, it is significant because it increases. Well, the free eugenol present in the root canal sealer, it is not biocompatible and it increases. Remember, the free eugenol will always increase the cytotoxicity. So eugenol, it is a component that is found in the root canal sealers, and when it is released or become free in the sealer, it can have a cytotoxic effect. That is, it is toxic to the living cells. So that is why it is important to minimize the presence of free eugenol in such dental materials to ensure the biocompatibility. The eugenol free sealer is, number one option is, first option is Goalmds sealer. The Goalmds sealer, it contains eugenol. So it is not eugenol free. Option B is AH26. It is eugenol free. So remember, AH26, it is eugenol free as it is epoxy resin sealer. So it will not contain eugenol. The option C, tubely seal. It is a zinc oxide eugenol based sealer. Option D, Wag paste. It is zinc oxide eugenol based sealer. So your answer is B. The hardest of all abrasive is, the first option is silicon carbide. It is hard abrasive, but it is not the hardest among the options provided. Emery, it is naturally abrasive. It is a natural abrasive that is made up of aluminum oxide. And iron oxide. Diamond, yes. Diamond is the hardest of all abrasive. It has a Noob hardness number of around 8,000. So diamond, it is renowned for its extreme hardness and it is used for cutting and grinding hard and brittle materials like enamel, porcelain, etc. Aluminium oxide, it is commonly used abrasive material and it is quite hard, but it is not as hard as diamond. So your answer would be diamond. What factors most affects the adaptation of the gold foil to the cavity walls? For proper adaptation of the gold foil, the condensation should be done at the 45 degree to the cavity walls. So once the gold has been condensed, the force should act at 90 degree to the previous condensed gold. The condensation, it starts from the center to the periphery. So option A, size of condenser. The size of condenser, it can influence the adaptation of gold foil to some extent, and it is not the most critical factor. The direction and force of condensation are more important for achieving proper adaptation. So the answer is direction of force. The shape of condenser, such as design of nib or tip, can affect how gold is condensed, but it is not the critical factor for adaptation. Force applied is indeed the important for gold foil adaptation, but the direction is most important. Other name of the electroprecipitate gold is, it is matte gold. So remember, matte gold is an electrolytic precipitate. The electrolaw, it is term used for electrolytic precipitate of gold. The option is B, electrolyte. It is the term that is associated with electrolytic precipitate of gold. Which of following should be used to clean the operating site before giving composite restoration? Before inserting the composite restoration, the operating site is cleaned with the pumice slurry to remove the plaque, pellicle, and superficial stain. Profile paste containing fluoride, glycerines, and flavoring agent should be avoided to prevent conflict with the acid etching technique. During casting procedure, creation of hot spot means, well, the hot spot, if the screw it is attached at right angle to broad surface, that will cause metal to impinge on mold surface, and that will create a hot spot. So that can be prevented by, so the answer is B. It can be prevented by attaching the screw at 45-degree angle. So remember, the hot spot, it creates a suck back porosity. So we have discussed very well in casting procedure. You can go through that chapter for more explanation. Electrolyte, it is a matte gold alloy with electrolyte. It is a matte gold that is alloy with 0.1 to 0.5% of weight of calcium wrapped in number 4 foil. So answer is A. The link between composite and the tooth, it is formed by the dentin bonding agent. So we have discussed that primer, it is a crucial component in the bonding. The link between the composite and tooth, it is formed by the dentin bonding agent. The dentin bonding agent is designed to create a strong link bond between the composite resin and tooth structure. So that is important component of the bonding process. The abrasive garnet is made up of silicate of aluminium, cobalt, magnesium, and manganese. So during annealing of gold, one of following does not occur. So first option is removal of contaminated sulfurous gases. That is a valid part of annealing process for gold. And the annealing process, it helps to relieve the internal stresses in the gold, making it more workable and less prone to brittleness. Annealing can also result in recrystallization of alloy. So removal of wax coating over gold. So answer is removal of wax coating over gold is tip that does not occur with the The cement for orthodontic use differ from those for restorative purpose that so answer is A. Have a liquid that contain more free phosphoric acid. So having a liquid that contain more phosphoric acid, so this acid it is used for etching the enamel surface that aids in retention. That is a critical aspect for orthodontic treatment. So this acid helps create a roughened surface on the enamel for better bonding. So the cement for the orthodontic use differ from those for restorative purpose in that the liquid contains more free phosphoric acid is the answer. Composite bonding is mechanical. So composite, they do not adhere chemically to tooth structure, micromechanical retention that can enhance the adhesion to the tooth structure. Advantage of chromium is added to casting investment. Which property is affected? Corrosion resistance. Chromium, we know it is added to casting investment to improve their resistance to corrosion. Zinc phosphate differs from GIC by modulus of elasticity. So the modulus of elasticity, zinc phosphate has a higher modulus of elasticity compared to the GIC. That makes it stiffer and less flexible. The principal modifier of zinc phosphate cement is magnesium oxide. The most common reason for incomplete casting when using a centrifugal machine is narrow screw. So narrow screw, it can restrict the flow of molten metal into the mold that can lead to incomplete casting. It can cause insufficient metal to reach all the areas of mold that results in defect in the final casting. So most common reason is narrow screw. But kind of luting failure tends generally to occur when chemical bonding are used for luting. The cohesive failure means that failure occur within the cement itself. So the most common failure is the cohesive. What kind of luting cement generally tends to occur when chemically bonding cements are used for luting? It's the cohesive failure. What are the material of choice as liner and base under the composite filling? It's the calcium hydroxide and glass ionomer cement. So they are most common used as liner and base under composite filling. So which of following cement should not be used for cementation of precision casting? It's the resin cement. Resin cement, they have a higher film thickness that can make it more difficult to achieve complete setting of casting. So removal of excess resin cement can be challenging if delayed, if the polymerization is the removal of excess cement can be challenging if delayed until polymerization is complete. If removed too early, it may result in voids which can increase the risk of secondary caries. The palladium, it is added to gold, and which is not true regarding. Well, the palladium whitens the gold alloy. It raises the melting range of the gold alloy as well as their elastic modulus, strength and hardness. the platinum, it lowers the density of gold alloy. So your answer is A. The light cure lining, glass ionomer cement are classified as type 3. Gereftor, it is an adhesive resin-based perforating repair material that is used in endodontics. It can be used for repairing root perforation that occurs during the dental procedure. So answer is A. Which of following is a dye hardener? It's cyanoacrylate. Localized shrinkage porosity increases due to the lack of reservoir. It occurs when there is lack of reservoir to supply the additional molten metal to compensate for shrinkage that occurs during solidification. So if the gold content of alloy it decreases, then both the strength and ductility decreases. So when gold content in alloy decreases, it is often replaced with other metals like copper, silver and palladium. So we know gold, it is a soft and malleable metal. That means it is not very strong, but it can be stretched and bent easily. So it imparts good ductility and malleability to the alloys. So when you reduce the gold content and introduce the harder material like copper or silver, the overall strength increases. This is because these harder metals contribute to alloy ability to resist deformation and withstand forces. On the other hand, ductility, which is the ability of material to deform plastically without fracturing, decreases. So gold, it is highly ductile. So as you reduce its content in alloy, the material becomes less capable of undergoing significant deformation without breaking. So when the gold content of the alloy decreases, the strength would increase and ductility would decrease. So when gold content of alloy decreases, the alloy becomes stronger but less ductile. Moving to the next question. Which of following is the finest of all polishing agent used on gold casting? It's the rough. Rough that is composed of iron oxide. It is one of the most finest polishing agent that is used on the gold casting. It is commonly applied with a soft bristle brush or small muslin buff. Puff wheel to achieve a highly polished surface on gold dental casting. So the rough, it is known for its smooth and shiny finish. So rough, that is a red, it is a red polishing compound that is composed of iron oxide. The particles, they are extremely fine and much finer than those found in other polishing agents. So these fine particles are responsible for producing a high finish surface. It is mildly abrasive, that means it can remove very small imperfection and scratches on the surface of gold without damaging the underlying metal. It has a high shine, so it will produce a smooth shiny surface on the gold casting. During polishing of amalgam restoration, whenever the temperature exceeds 65 degrees Celsius, mercury is relieved from amalgam. So when amalgam restoration, they are polished at temperature exceeding 65 degrees, there is a risk of releasing mercury vapors from the amalgam material. So that can lead to defective restoration, and there is a hazard regarding the inhalation of that mercury vapors that are toxic. So it is essential to avoid excessive heat generation during the polishing process. Cohesive gold used as bulk filler, it is matte gold. So matte gold is used to build up dental restorations like inlay, onlays and crowns. So it is designed to be cohesive and easy to work with during the during the dental restoration. So that is example of natural abrasive. It's Arcanas oil stones. So remember, the sharpening stones, they are made up of abrasive crystal that are harder than the metal. So example is Arcanas oil stones. When multiple unit prostheses is to be cemented using zinc phosphate cement, the preferred technique is use of cool glass slab for mixing. So zinc phosphate, we know option zinc phosphate, it is a common used dental cement for cementing crown, bridges and other prostheses restorations. So it is important to handle and mix this cement correctly to ensure successful cementation process. So we know zinc phosphate cement, it is product of chemical reaction between zinc oxide powder and a liquid phosphoric acid. So the reaction, it is exothermic, that generates heat. So mixing on a cool glass slab helps to control the temperature of the cement during mixing, so preventing it from setting too quickly due to the excess heat. So there would be mixing on cool glass slab extends the working time of the cement. So when cementing multiple unit prostheses, that may require more time for proper placement and adjustment. So your answer is B. The eugenol has an obtundant effect. Eugenol, it is a key component of many dental materials, including the temporary cements and dental filling. It is known for its mild obtundant properties on the dental pulp. So obtundant means that eugenol, it has a soothing or calming effect on dental pulp. So when used in deep cavities or in close proximity to the pulp. So its obtundant effect is due to its mild anesthetic properties and ability to reduce the irritation and inflammation in the pulp tissue. The curing light for light cure composite should produce minimum light of, answer is 475 nanometer per millimeter square. So this specific wavelength of light, it is necessary to activate the photoinitiator. in the composite material that would initiate the polymerization process that hardens the composite. Cement that are having neutral pH. They are the zinc oxide eugenol cement. They have a neutral pH. The glass ionomer, zinc phosphate, they are acidic in nature, whereas the calcium hydroxide, it is basic. Temperature, which of following gas has highest flame temperature? It's the acetylene. Acetylene has highest flame temperature. It burns at extremely high temperature when combined with oxygen, making it suitable for various weldings, cuttings, and metalwork applications. The temperature for brazing is 450 degrees Celsius. So brazing and soldering are both metal joining process that use a filler material to bond two surface of metal. The soldering, it occurs at a lower temperature, usually below 450 degrees Celsius. Brazing takes place at higher temperature, typically above 450 degrees Celsius. The test commonly used to assess the xenoestrogenicity activity is, now what is this xenoestrogens? These are the substance that mimics the effect of estrogen in body, and they can disrupt the endocrine system. They are found in environment, pollutants, plastics, and certain chemicals. So the E-screen assay test, it is used to assess the xenoestrogenic activities. It measures the ability of various compounds, including environment, pollutants, and chemical, to mimic the effect of estrogen in the living cells. So the E-screen assay, it uses human breast cancer cells. That are estrogen sensitive. These cells, they are grown in a culture dish. So the cells, they are exposed to different compounds suspected to have estrogenic activities. So estrogen will promote the growth of these cells. So the extent of cell growth in presence of each compound, it is measured. So it is valuable for evaluating the estrogenic effect of various compounds, helping researchers identify the substance that may disrupt the endocrine system. Next question, BPA and BPA dimethacrylate, they are xenoestrogens. Coupling agent present in composite is organosilicate. The organosilicants, they are commonly used as coupling agent. Coupling agents are the substance that helps to improve the bond between filler particles and resin matrix in the composite. The compound commonly used coupling agent in conventional composite resin, it's the zirconiates. Coupling agents in the filled composite resins, coupling agents like titanates, zirconiates, they are commonly used. So these coupling agents play a role in bonding the filler to the resin matrix. that would improve the physical and mechanical properties of composite. Diamond burrs are used for occlusal reduction of tooth surface in which color-coded band refer to the depth of cutting portion. Well, remember 1 mm white in color, 1.5 mm green in color, 1.8 mm orange in color. When the band it is white in color, it indicates it has a cutting depth of 1 mm. So that is your answer. Electroalloy, it is a matte gold alloyed with calcium. So electroalloy, it is a matte gold alloy with 0.1 to 0.5% by weight of calcium, wrapped in number 4 foil. So when mixing, the liquid should be spread with spatula over a surface of about, the answer is B, 1.5 to 2 centimeter. The reducing zone of flame. Well, in a flame, there are various different zones. The reducing zone, which is the innermost. The innermost layer is the reducing zone, that is blue in color. So blue zone is where the combustion is incomplete and there is shortage of oxygen, resulting in reduction of metal oxide to their metallic form. Which of following is a unidirectional procedure? Cutting and grinding, remember, they are predominantly unidirectional procedure. Therefore, they cut in one direction only. The cutting involves the removal of material in specific direction, and the cutting tool or the instrument, it moves in that direction. The channel through which molten metal reaches the mold in an investing ring after the wax has been eliminated, it is sprue. So in the process of casting metal objects, an investment ring, it is used to create a mold. The wax pattern, it is placed in the mold, and when wax is eliminated, usually by the melting it out through a channel called the sprue, remains. The sprue, it is the path through which the molten metal is poured into the mold to form final object. The hardness of which of following abrasive is maximum? Well, the boron carbide, it has highest hardness among the options. The KHN number of boron carbide is 2800. The set zinc phosphate cement should, so after the zinc phosphate cement has set, it should not be allowed to dry out. That cause shrinkage and crazing of the surface. That leads to disintegration. So after it is allowed to dry out, it can lead to shrinkage and crazing of surface, that can lead to disintegration of the cement. It is a common practice to cover the set cement with a cavity varnish layer to minimize the dehydration and prevent premature contact with the oral fluid. So, answer is D. The fluoride, it is incorporated in the flux used for stainless steel. What is the function of fluoride? The fluoride dissolves the passivating film supplied by chromium. So chromium, it forms a protective passivating layer on the surface of stainless steel, so which prevents corrosion. The fluoride is added to flux to dissolve the chromium passivating film that allows the solder to adhere properly. So this passivating film, it can hinder the wetting of the surface by the solder. The matte gold, it is made by electrolytic precipitation. Goldent, it is a powdered gold. The goldent typically refer to powdered or granulated gold. The property of the gold that allows for a better marginal finish, it is the ductility. Ductility is the property of material that allow it to be stretched, bent or deformed without breaking. So ductility, it is a crucial property because it allows the gold at cabo surface margin to move or burnish closer to the die or tooth surface. So that results in better marginal finish that remain intact for many years. Sprue former direction should be at 45 degrees. It should be at 45 degrees rather than at a right angle to the broad surface. So that reduces the turbulence within the mold cavity and minimizes the porosity in the casting. The setting of zinc phosphate cement, it is retarded by, answer is decreasing the rate of addition of the powder to liquid. The particle size of a microfiller in dental composite, it is D. The activator in cold cure acrylic resin is C-dimethyl paratoluene. Cohesion of direct gold at room temperature, it is example of atomic attraction. The cohesion of the direct filling gold at room temperature, it is example of the atomic attraction. So that refers to attractive forces between the atoms within the gold material that hold it together. Dash flame, it is the hottest of all. It's the acetylene and oxygen. So it can achieve the highest temperature required for melting various types of dental alloys, including the base metal alloys. Titanium casting, it is done under vacuum in argon atmosphere. Matte gold, it is made by, so matte gold, it is electrolytic precipitate of pure gold. It is made by electrolytic precipitation. The melting force is directed, it is 45 degree to the wall. To best compact the gold. What could be the cause of incomplete rounded casting? it is due to insufficient casting pressure. So insufficient round casting, it can occur due to the insufficient casting pressure. When the pressure is inadequate, the back pressure of entrapped air in the mold cannot be overcome, resulting in rounded and incomplete casting. For zinc oxide eugenol, all of following are true except the C is not correct. The addition of ortho-ethoxybenzoic acid in concentration 37 to 50% does not increase in the strength of zinc oxide eugenol cement. The role of indium in amalgam is to reduce the release of mercury during amalgam polishing. Indium, it is added to dental amalgam to reduce the release of mercury vapors when set amalgam is abraded during polishing. So it helps to minimize the potential exposure to mercury vapors. That is a safety concern while working with the dental amalgam restoration. The polishing agent that is used in air abrasive technology, it is sodium bicarbonate. Very important for your MCQ exam. Many times asked in exam, the polishing agent used is sodium bicarbonate. All of following are used as an accelerator in zinc oxide eugenol cement except bromoglycerine. So various accelerators can be used in zinc oxide eugenol cement to control its setting time. However, bromoglycerine, it is not commonly accelerator that is used for this type of cement. The other options like acetic acid, zinc acetate and calcium chloride, they are not known as accelerators in the zinc oxide eugenol cement. In the restoration of the deep cavity with the composite resin, the following precautions have been taken to protect the pulp. The calcium hydroxide base, which act as a protective liner between the composite resin restoration and the pulp, that helps to prevent the irritation and promote pulp health. So during storage of gold foil, the oxide layer is prevented by contamination of gold foil with they are often contaminated with a specific concentration of ammonia. 18% ammonia is used to protect the gold foil from the oxidation. Remember that. The fine abrasive instrument have a particle size of, remember these particle size, it is categorized in coarse, medium, fine, very fine. So mark your answer accordingly. The fine comes under 60 to 70 micrometer. That is, state your answer.